Thank you. Thank you, Mr. Chairman.
Senator Cassidy.
Hello, Mr. Secretary.
Senator?
Mr. Secretary, I'll also echo some disappointments. When we first met, I expressed to you how in previous administrations, not of presidents, but of secretaries, it had been very difficult to have transparency with the VA. And you assured me that was not going to be the case under your watch. And as a physician, I have, at least a little bit of an ability to look at productivity numbers to get a sense of what those productivity numbers are. I just know what a well-run clinic, how it goes. So my staff requested information regarding Veterans Health Care in the Community Care Center, and we were told to submit a Freedom of Information Act. This is Congress. This is the VA committee, which is supposed to be providing oversight, and we were told to submit a FOIA. It kind of took things to a new level because I once told you of an episode where we requested something, we got it 6 months later, it was off point. We requested it and it came back 6 months later, it was off point. And it was just a rope-a-dope in terms of getting us information. That actually looks good relative to being asked to give a FOIA. I don't know how to say that is such disrespect for the institution of Congress.
I'll take it and I'll dig into it.
It just blows my mind. And I'm sorry to be so frustrated, but I am representing people. And when those people feel as if the VA is doing nothing but hiding, it's not me, it's the people I represent, the veterans I represent, who are really being offended. So just to say that, and if we could have a point person that we could contact and that is accountable to you, and I can call you up and say, Dennis, we had a great meeting, man, what's going on? And you could ride herd over this person, because I suspect you didn't know about this, but it's being made by somebody who doesn't want to give us information. So if we could have that and your staff could relay to Christian, raise your hand, man. Then I would appreciate that sort of workaround on something which is wrong.
Fair enough.
Okay. Secondly, kind of related to the same. On April the 12th, our office sent a letter to you regarding the ineffectiveness of the VA's opioid safety initiative and asked what barriers Congress should remove in order to better public-private partnerships to increase veterans' access to testing and treatment. There was an August 21 report in Washington Post, which kind of motivated this, which showed that after the introduction of the opioid safety initiative, suicides among veterans in the rural areas increased by 75% and increased in the urban area by 30%. We have not heard back from a letter that we sent on April the 12th about a program which the Washington Post is reporting was at least associated temporally, we don't know causally, with a 75% increase in veteran suicide in rural areas. I don't know. Any comment?
No, I'll get to the bottom of it.
Okay. And again, I'm sorry to seem as agitated as Senator Sullivan, but you can imagine when I come to my staff and I say, hey, man, I'm all excited about this. We put something together, worked really hard on it, we sent it off, and we want to have a FOIA request. The next issue is, and again, I've always enjoyed our interactions, so I'm sorry for the unpleasantness of this. There is again, I'm a physician, and I know there's certain productivity measures that they're just a way a well-functioning outfit should work. It's my concern that in some places that there's a lot of folks employed, but not as many patients being seen. Frankly, I think there's some facilities the VA would choose to close because of lack of adequate patient volume. I actually see that as important. You'll have my support, depending on where it is. But the point, but the point being is that we should expect a certain amount of patients seen per provider in order to, just have a well-functioning clinic, even to keep up clinical skills. This is what the GAO report, I'm sure you're familiar with it, reported in 2017, the VA did not maintain an accurate count of physicians providing care in the VA, hindering the ability to ensure the appropriate number of the clinical workforce, I'd say the appropriate number of people being seen per physician, and also lack data on the number of contract physicians providing care in the VA because its personnel databases and workforce planning tools did not include contractors. Now, I don't know how many contractors you are, but contractors are a pretty important part. Have you all corrected that? Do we have a, because one thing I want to know is patient volume per provider. And so has that been updated and what's going on?
It sounds like I heard you say 2017, not the GAO report, is that right? So I assume it's been updated, but let me take and find that out. But we track average daily census in our facilities, which obviously helps us make sure that we're tracking, most importantly, patient safety, which is obviously derivative of whether our docs, our nurses, our specialists are getting adequate rounds, adequate time on target. And so I'd be happy to work through that with you. But I'm assuming from a 2017 GAO report, we've done that, but let me take and dig that.
Well, I'll finish by saying this. The reason I asked is one thing we've asked for is data sets so that we can actually look at this data ourselves. And of course, we've not heard back. But on the other hand, if what we're receiving doesn't take into account contractors, it would unfairly portray. And I'm doing this I'm absolutely not doing this to go after the VA. I'm doing this to gain understanding.
Yeah.
But if I have to be aware of the limitations of the data which we would hope to receive before we do that. So
okay.
If they could have that codicil or that addendum to that, I'd appreciate it.
Got it.
Thank you.